Okay, so we're diving into uncharted territory today.
Hmm.
Well, uncharted for some of us anyway. We're talking about a guide for first-time parents from Nemours Kids Health,
Oh, great.
medically reviewed by Dr. Amy W. Anzalotti. And, you know, tons of you guys are brand new parents or about to be and kind of freaking out a little bit,
Hmm.
which totally understandable. Those first few weeks with a newborn, let's just say they can be a wild ride. So we're here to help you feel a little more prepared, a little less overwhelmed, ready to decode this guide and grab some solid advice.
Yeah, I think what's really cool is how this guide just starts right off the bat by acknowledging how much responsibility you have. Like, this tiny human is totally dependent on you for literally everything.
Yeah.
So I think this deep dive is all about giving you the tools and the knowledge to meet that challenge and feel confident doing it.
It really is. And, one of the first things the guide talks about is just how fragile newborns seem.
Yeah.
And I think that's something that every new parent, it's like you're scared to even breathe on them too hard.
Mm.
And so it breaks down some really important, like super basic handling advice.
Right.
First up, hand washing.
Right.
We all know it's important, but with a newborn, it's like next level.
It's non-negotiable.
Non-negotiable, yeah.
Their little immune systems are just getting started.
Yeah.
So something that might just be a sniffle for you or me, oh man, for them it could be a huge illness. So washing your hands before every interaction, before you pick them up, before you feed them, change their diaper.
Yeah.
It's the simplest thing, but it's so powerful in protecting them. It's like building a little safety bubble around your baby.
It really is, and I think it's such a good reminder because you're so sleep deprived.
Right.
You're so overwhelmed in those early days that sometimes it's easy to forget, like, the simplest things.
Totally.
Another key thing that the guide emphasizes, supporting their head and neck, like constantly.
Yeah.
Because they haven't developed those muscles yet.
They don't have the strength. Nope.
And so every time you hold them, cradle them, burp them, like even just moving them around, that support needs to be there.
You're their external support system until those neck muscles are ready to go. And honestly, it becomes second nature.
Yeah.
Like before you know it, your hand is just automatically cradling their head. It's like an instinct.
Okay, so here's where it gets really serious.
Okay.
The guide is super clear about this.
Yeah.
You never, ever shake a baby. Like ever.
No.
And it explains, why. Shaking can cause like bleeding in their brain.
Yeah.
And it can be fatal.
It's incredibly dangerous.
So if you're feeling frustrated, you need to wake them up.
The guide suggests, gentler ways to do it, like tickling their feet.
Yeah.
Or blowing gently on their cheek.
Right.
Anything but shaking.
Yeah, it's so important to understand how delicate their brains are at this stage. Like, even a little shake can have devastating permanent effects.
Yeah.
And those gentler methods, they work just fine.
And if you ever feel yourself getting so frustrated that you think you might shake them, please put the baby down in a safe place like their crib and walk away.
Yeah.
Take a few minutes to calm down, like breathe deeply, call a friend, a family member, your partner. Don't be afraid to ask for help.
Absolutely. Your mental health is so important too. And we'll actually talk more about all of that in a later episode.
Yeah.
But yeah, put the baby down, step away, take care of yourself, and then come back.
Yeah.
The guide also covers safety and like carriers and strollers and car seats. And, obviously buckling them in correctly is huge.
Yeah.
But it also talks about the type of movement that they experience.
Right.
You want to avoid anything like super rough or bouncy. So no, jiggling them on your knee or tossing them up in the air.
Right.
Not yet. Anyway.
Not yet. Think gentle, controlled movements.
Right.
Their little bodies aren't equipped to handle those sudden jerky motions yet. So in their carrier and their stroller, they're good to go.
Yeah.
But yeah, no need for rough housing just yet.
Exactly. Okay, so let's shift gears a little bit and talk about something really special, which is bonding. The guide describes this as that deep connection that you start to build in those first hours and days. And it's not just about, keeping them fed and changed.
Right.
It's about creating this emotional bond. It even uses the phrase falling in love with your baby, which I think is so sweet. And it emphasizes how vital that bond is for their development.
It's beautiful, isn't it? And it's so true. Like from a developmental standpoint, that early bonding really sets the stage for their emotional well-being.
Yeah.
That feeling of security, of trust. And on a physical level, all that closeness releases hormones both in you and in your baby.
Yeah.
And those hormones help create and strengthen that attachment, that connection.
Right. And the guide gives some really nice specific ways to build that bond right from the start. Simple things like, holding them close,
Mm.
cradling them, gently stroking them in different patterns.
Mm.
But one technique that it really highlights is skin-to-skin contact, which
Mm.
is also called kangaroo care. So can you talk a bit about why this is so important?
Oh, absolutely. Skin to skin is like the superpower. Like you're holding your baby just in their diaper against your bare chest.
Yeah.
And it helps to regulate their heart rate, their breathing. It can even help with their temperature control. And for you, for both parents, it releases all those feel-good hormones that promote bonding.
Yeah.
It's amazing how powerful that simple physical closeness can be.
It really is. And the guide even goes into some practical steps for making skin-to-skin really effective. Like it says to skip the perfume or cologne beforehand.
Right.
To be mindful of any smoke, cigarette smoke or anything like that.
Yeah.
And to create this calm, kind of dimly lit environment.
Yeah, peaceful little nest.
Yeah, exactly. And for the parent, wearing a shirt that opens in the front makes it easier.
Yeah.
And then it's just, placing your baby right on your chest.
Mhm.
Just letting them be there, talking softly, humming, singing, maybe even reading aloud.
Yeah.
And the guide mentions that it's totally normal if your baby falls asleep during this time.
Of course, they're so little.
Yeah.
But even when they're sleeping, they're taking it all in. Like they're feeling your heartbeat, your warmth, your unique scent.
Right.
All these things reinforce that sense of safety and security.
Okay, so let's move on to soothing.
Hmm.
Because let's be real.
Yeah.
Every new parent quickly becomes a pro at trying to figure out how to comfort their little one. The guide suggests a bunch of strategies to help babies relax.
Mhm.
One of them is infant massage. It can be super helpful, especially for preemies or babies who've had some medical issues.
Right.
And it can help with bonding and development too.
Mm-hmm.
But the guide stresses that you got to use a gentle touch, like super gentle.
Yes, very light pressure.
Yeah, and it suggests checking with your doctor for resources or, to learn some techniques.
Yeah. Absolutely. Massage can be wonderful for relaxation and circulation, but because they're so tiny and delicate, you want to be extra careful with the pressure you use.
Yeah.
Your doctor can help you find safe and effective methods that are right for your baby.
Sounds also play a big role in soothing.
Oh, for sure.
The guide says babies really respond to vocal sounds. So your voice, talking, babbling,
Yeah.
singing, cooing,
Yeah.
all that good stuff. And then soft music, rattles, musical mobiles, those can be nice too.
Mm-hmm.
And for a fussy baby, the guide recommends kind of combining those things, like sing a lullaby while you're gently rocking them,
Yeah.
or recite a rhyme, or even just read aloud.
It makes sense that they love the sound of your voice.
Yeah.
They've been hearing it, muffled, of course, for months in the womb.
Yeah.
It's familiar and comforting. And that rocking motion, the rhythm, it can be so effective at calming them down.
Okay, so here's something interesting that the guide mentions. Sensory sensitivity.
Oh, yeah.
It says that some babies are just more sensitive to touch or light or sound.
Right.
And they might startle easily, cry more, sleep less, or even turn away from stimulation. And in those cases, the advice is to keep things pretty chill. Like keep the noise down, the lights low.
Yeah, create a calm and soothing environment for them.
Right.
Every baby's different. Just like us, they have their own little personalities and preferences.
Yeah.
So paying attention to their cues and adjusting their surroundings to make them feel safe and comfortable, that's key.
Now let's talk about swaddling.
Oh, yes, the swaddle.
The guide describes this as a super effective soothing technique, at least for some newborns,
Right.
especially in those first few weeks.
Yeah.
And it involves, wrapping your baby snugly in a blanket,
Mhm.
keeping their arms kind of tucked in, but allowing some movement in their legs. And this can help them feel warm and secure, and it can minimize that startle reflex that often wakes them up.
Swaddling basically mimics that feeling of being held tightly and snugly like they were in the womb.
Yeah,
So it makes sense that it would be so comforting for them as they adjust to life outside.
totally. And the guide gives step-by-step instructions for how to swaddle correctly.
Mm-hmm.
So you lay the blanket out in a diamond shape.
Okay.
You fold down the top corner, place the baby face up with their shoulders just below the fold,
Mm-hmm.
bring one corner across their body, tuck it snugly under their back,
Yeah.
bring the bottom corner up and over their feet, making sure it's not too tight around their face,
Right.
and then wrap the other corner across their body and tuck it under their back as well.
Okay.
They're very specific about making sure their hips can be slightly bent and turned out, because that's important for preventing hip problems.
Right.
And a good way to check if they can breathe comfortably is to see if you can slip a hand between the blanket and their chest.
Mm-hmm.
You don't want it too loose, but you definitely don't want it too tight either.
Right. Those details are so important. The snugness around the arms helps prevent the startle reflex,
Yeah.
but the hips need that freedom to move for healthy development. And being able to slip your hand in there, that's the key to making sure they're not restricted and can breathe easily.
Okay, so this is really important. The guide says you have to stop swaddling as soon as your baby shows any signs of trying to roll over,
Oh, yeah.
which usually happens around 2 months,
Right.
because at that point, swaddling could actually increase the risk of SIs.
Is that right?
Because if they roll onto their tummy, they need their arms free
Mm-hmm.
to be able to push themselves up.
Exactly. Once they start rolling, they need those arms to be able to reposition themselves. It's all about safety at that stage.
Okay, let's get into some of the nitty-gritty basics.
Okay.
Diapering. The guide says you'll probably be changing diapers like 10 times a day in those early weeks,
Wow.
which can feel like a full-time job.
It is a full-time job.
It is a full-time job,
Yeah.
yeah. It also says to keep all your supplies close by, within easy reach.
Yeah.
And when you're cleaning, you want to wipe gently front to back with plain water, cotton balls, a soft washcloth, or you can use fragrance-free wipes. Diaper cream can help if they get a rash.
Mm-hmm.
And washing your hands thoroughly with soap and water after every diaper change.
Every single time.
Every single time. Super important.
For everyone's health. Yeah, that high number of diaper changes, it just highlights how much those little systems are working.
Yeah.
They're constantly eating and eliminating.
Yeah.
Having all your stuff organized and nearby, that's going to make your life so much easier.
Yeah.
And you're absolutely right. Hand washing is non-negotiable.
Yeah.
It's the best way to prevent the spread of germs and keep both you and your baby healthy.
Okay, so bathing routines, they actually kind of evolve in those first few weeks.
Okay.
The guide recommends sticking with sponge baths until that umbilical cord stump falls off.
Right.
And if your baby was circumcised, until that's totally healed. After that, you can transition to using a sink or a small infant tub. But the guide says those first few tub baths should be short and sweet.
Yeah.
And if your baby seems super stressed out by it,
Right.
it's totally fine to just go back to sponge baths for a while.
And yeah, no need to force it.
Yeah, exactly. And get this, the recommended frequency for baths in the first year is only like 2 to 3 times a week
Oh, wow. That's interesting.
because you don't want to dry out their skin.
It makes sense. Their skin is so sensitive at this age. You don't want to strip away those natural oils.
Yeah.
So focusing on keeping the diaper area clean and wiping up any spit up or messes, that's usually enough between baths.
Okay, so speaking of the umbilical cord,
Okay.
the guide gives clear instructions for how to care for it.
Yeah.
So you basically clean around the base of the stump with plain water, and then you pat it dry.
Okay.
You want to keep it dry until it falls off naturally,
Right.
which usually takes between 1 and 3 weeks. The guide says it's super important not to submerge it in water. And it also explains that the color will change from yellow to brown or even black as it dries,
Okay.
which is normal.
So don't freak out.
Don't freak out, right?
Yeah.
But if you see any redness spreading around the base or a bad smell
Yeah.
or any kind of pus-like discharge, those are signs you should call your doctor.
Right. Better safe than sorry. Keeping it clean and dry helps it heal and detach naturally.
Yeah.
But yeah, any redness, odor, discharge, those are signs of possible infection, so it's good to catch those early.
Now, for circumcision care, the guide explains that doctors will usually apply petroleum jelly to the tip of the penis and cover it with gauze to prevent it from sticking to the diaper.
Okay.
With each diaper change, you gently cleanse the area with warm water. The guide says to avoid baby wipes because they can be irritating.
Right.
That you reapply a thin layer of petroleum jelly and a fresh piece of gauze. It usually heals within a few days to a week, but if you see increasing redness, swelling, or any pus-filled blisters, that's a sign to call the doctor.
Got it. So again, gentle care to help it heal and prevent infection.
Yeah.
The petroleum jelly creates a protective barrier,
Right.
and it's important to keep an eye out for any signs of trouble.
Okay, let's tackle the big two.
Okay.
Feeding and sleeping. When it comes to feeding, the guide strongly recommends feeding on demand, meaning you respond to your baby's hunger cues whenever they show up, crying, bringing their hands to their mouth, making sucking noises.
Right.
And for newborns, this usually means feeding every 2 to 3 hours around the clock.
That sounds about right. And it's such a good approach because you're really tuning in to your baby's needs.
Yeah.
You're responding to their cues before they get too upset.
Yeah.
And that frequent feeding schedule, it just reflects how quickly they're growing and how tiny their tummies are.
Right. The guide offers some helpful signs that your baby's getting enough milk if you're breastfeeding. So they seem content after feeding. They're having 6 or more wet diapers and several bowel movements each day. They're sleeping well between feeds, and they're gaining weight steadily. And it also mentions that your breasts will probably feel fuller before a feeding and softer afterwards.
Right.
If you're formula feeding, you can see how much they're taking in. But the guide's advice is, if you have any worries about your baby's feeding or their weight gain, definitely talk to your pediatrician.
Absolutely. Those are all good general guidelines, but every baby is unique.
Yeah.
So if you have any doubts, any concerns, please don't hesitate to reach out for professional guidance.
It's so important. Okay, the guide also reminds us to burp the baby frequently during after feedings.
Oh, yeah, the burping.
Yeah.
Got to get those air bubbles out. It
Exactly.
can make a big difference in their comfort level.
And finally, sleep,
Sleep.
the holy grail. The guide says that newborns typically sleep a lot,
Okay.
like around 16 or more hours in a 24-hour period. But it's usually in short bursts, like 2 to 4 hours at a time.
Right.
And while some babies might start sleeping for longer stretches, even sleeping through the night at around 3 months, it's completely normal if it takes longer.
Totally. They all develop at their own pace.
Yeah.
And those early months with all those short sleep cycles, it's a big adjust for parents.
It really is.
It's a good reminder that their sleep patterns are still developing. They're not like mini adults.
Exactly. Okay, so this is super important. The guide goes over safe sleep practices
Okay.
to reduce the risk of SIDS. So always put your baby on their back to sleep on a firm, flat surface, and avoid any loose bedding or soft objects in the crib.
Right, like blankets, pillows, stuffed animals.
Exactly, because those can create a suffocation hazard. They also recommend that you share a bedroom with your baby for at least the first 6 months and ideally the first year, but not share a bed. And to help prevent flat spots on their head, you can alternate which direction you place their head in a crib each night.
All good advice. Following those safe sleep guidelines, it's one of the most important things you can do to protect your baby. You're creating a safe sleep environment and minimizing the risk factors associated with SIDs.
Right.
Sharing a room, but not a bed, allows you to be close for nighttime feedings and comfort while still keeping them safe.
Yeah.
And switching up their head position can help prevent that flat spot. Yeah.
Okay, so as we wrap up this deep dive, one of the most reassuring things that the guide says is that with time, you'll find your own rhythm as a parent, and you'll start to feel more confident in your abilities. It takes time and patience to establish these routines, and you and your baby will figure out what works best for you.
That's so true. There's no one-size-fits-all approach to parenting.
Yeah.
This guide provides a great foundation, lots of helpful information and practical advice.
Yeah.
But the journey of parenthood is also deeply personal.
Yeah.
You'll learn and adapt to your baby's individual cues and needs. It's an amazing process.
And the guide's final piece of advice is, don't hesitate to reach out to your pediatrician with any questions or concerns.
Absolutely.
They are an invaluable resource.
Your pediatrician is there to partner with you every step of the way.
Yeah.
No question is too small or insignificant.
So as you embark on this incredible journey of parenthood, think about this. Those seemingly simple acts of care in these early weeks, the gentle touch, the soothing sounds, the secure embrace,
Yeah.
they lay the foundation for a lifetime of connection and growth. And how will you, with your own personality and family dynamics, shape the unique way you parent your child? It's a transformative experience, and we hope this deep dive has given you some helpful information and maybe a little boost of confidence as you navigate those precious early days.
We wish you all the best
Thanks for listening.
and happy parenting.
Bye.
Bye.